Hello and welcome back. Once again, I am Ashok Rajguru, your tutor, and this is the last video of this educational module. We'll be discussing the topic of support, what support we can provide to our patients who are suffering from the condition known as trigeminal neuralgia. However, there's a lot of stuff in this video which applies to other painful conditions as well. And please bear with me, but this is going to help you tremendously as a healer. The objectives of this lesson are to understand what pain is. As homeopaths, we are busy gathering the symptoms that are being expressed by the patient. But are we only looking at modalities? Are we only looking at descriptors? Are we only looking at locations? Or are we trying to understand what the patient is undergoing? That is what is meant by understanding pain. And the next few slides will take you through that process. Your role as a practitioner goes beyond just finding remedies. If you remember, Hahnemann had said that we are not just doctors, we are people who are healers. And our role is much beyond just being providers of medicine. In order to understand pain, the suffering of another person, the first thing we have to do is we have to be keen listeners. Now, one may say that as homeopaths, we are very observant. Yes, observation is different. Listening is being empathetic, trying to see from the perspective of the person who is suffering. Not just trying to find remedies that match that particular symptom. It is going beyond symptoms. It is connecting with that patient. And also in this video, we'll see the role of support groups to help our patients who are suffering from such a condition. Now, here are some wise words said by some very sensitive people and very successful practitioners. I'll just read them out. Pain patients require a lot of talking and a lot of listening. Exactly what I said in the previous slide. Patience and sensitivity. Not all doctors can or care to master. The right treatments can take months or years of experimentation. So although we read up a case and we find that this remedy worked and that was the end of the story, it can take in real life many months and sometimes years. And during that period, your role as a practitioner is to provide that essential emotional support which the person is seeking. We have to educate the public that grin and bear it is no good. You can't just console a person and say, oh yeah, I know. Yes, indeed, it's painful. I know. That is telling lies. I really don't know. I have not been through that condition. So please bear that in mind when we choose the words that we speak with our patients. Here's another slide just to acquaint you with what pain really means. The price of pain is very heavy because the person who's suffering from such severe pain as described by the condition known as trigeminal neuralgia, people are likely to lose a lot of self-respect because that pain may prevent them from grooming properly, cooking, participating with family activities. It can affect their employment and earning. And in return, that can affect their self-respect as well. They lose out a lot on the quality of life. They are unable to go outdoors as freely as they could if they did not have the pain. They are restricted in their socializing. They also lose a lot of their independence because they can't do shopping whenever they please. They can't drive to the places where they wish to go. And that gives them a feeling of dependence or a loss of independence. Pain can be sometimes so severe that it can lead to loss of sleep. And sleep deprivation itself causes a lot of other problems, both physiological as well as psychological, mental and emotional. Besides, people who are in deep pain are also on some pain-killing drugs. And those medicines have their own side effects, both psychological as well as somatic. And even people who come to you with the patient, close relatives, daughters, sons, spouses, parents, even for them, watching someone who they love in pain itself is a very burdensome and painful feeling. So, whenever you're dealing with such cases, you must bear in mind all these things which I have just told you. That brings us to yet another way we can help our patients, and that is by educating them or informing them about something known as affirmations. Affirmations are statements that you can suggest to your patients, which they can say to themselves many times a day. And that can help them form an image of well being. And then the mind and the body and the being will work towards getting better and feeling better, which is even more important. Some of these affirmation statements have been found to be very useful. I am not in pain, and the pain is not me. Pain is part of my life, but pain will not be my life. Though the pain fills my life, it will not take my life. Each day I live, I fight and show the pain who I am. I would like to say one thing. It doesn't mean that each person has to say all these affirmations. You will have to see what suits that person best. And in fact, you can make affirmations on your own, depending on the person, the personality, and the circumstances that the patient is in. These are just suggestions and to inform you that affirmations are something you can help your patients with. Another important way you can help your patients is by helping them to find some support groups. I'm not just talking about trigeminal neuralgia. You could have patients suffering from other conditions as well. And some cases can be quite rare, but support groups for all such conditions. Just as you have Alcoholics Anonymous for people who are suffering from alcoholism, you can always find support groups for various conditions. You have groups, support groups for parents whose children are suffering from ADD or from ADHD and such conditions. So try to find a local support group, because a support group provides a forum where the sufferers are able to get sympathy and they are able to exchange information with other non-sufferers. Many a times people find it difficult to express their feelings to family and friends. Very often family and friends might not know the gravity of the situation, or the person who is suffering may be hesitant lest he is labeled as a malingerer or a person who is always whining and moaning. So support groups are extremely important and very, very helpful. The very fact that they can speak to a fellow sufferer and share their suffering itself brings tremendous amount of unexpected relief in their mental makeup. Also, support groups are places where people exchange information and they teach each other to be active rather than passive in their condition. Sadly, most modern allopathic interventions leave the patient out of the whole equation, and the patient actually becomes a passive observer to the operations or to the activities or to the um, actions that are being taken on that person. Support groups teach people to be active rather than passive. And of course, they have a place to go where they are accepted and they are understood well. So all these things count towards making life much better for a person who is suffering from any such chronic condition, especially pain. Some support groups meet in person. There are some other support groups which provide support in person. Here are some stories that have been shared, or rather excerpts of stories that have been shared by people who have been suffering from this particular condition that we discussed in the educational unit. I'll just read it out. If it had not been for my friends and my faith, I don't know how I could have coped with the overwhelming fear I had to live with. What a wonderful story. This person was finding it difficult to cope with just living, and it has been the support of the friends and her faith that has brought her to a stage where she's in a position to help not herself but others as well. I attend a TN support group to encourage others to push through and seek answers. The answers for me did not come easy. So that's another very encouraging story, for the simple fact that even though the task is difficult, it is not impossible. Here's another one. This is from a person who has undergone a surgery. It has now been 15 months since my surgery. After effects of a surgery are still there. Slight stiff neck, tenderness in the surgery area, a slight hearing loss in my right ear, tinnitus in my right ear, and some very bad headaches on the right side. This person is having quite a lot of issues, but the tone and temper of the story suggest that he has been able to overcome that melancholy, that sadness, and the spirit not just to live on, but to continue and support others is there. And it does admit that yes, even after the surgery there are problems, but in no way are they comparable to what was happening earlier. Yet another story from another brave person who has been fighting this condition. This is a person who wrote this story back in 1999. I reached the age of 60, and during this watershed life experience, I also entered the hospital for a microvascular decompression procedure. This is something we talked about in the lesson earlier. The tick has gone, except for some numbness, an occasional sensation during the process of nerve regeneration, and a slight hearing impairment. The start of year 2000 has special significance to me. I'm sure you must have been able to notice and feel the enthusiasm that the person is expressing in this story. I would like to mention here that mindfulness, or meditation as it is often called, has been found to be very useful in clinical interventions, especially in connection with pain, trauma, and even many emotional conditions such as depression. There is tremendous amount of data available on the internet, which are scientific papers which support this. And mindfulness-based interventions have been proven to be clinically efficacious. The interest in incorporating mindfulness into clinical interventions in medicine and psychology is growing day by day. As a matter of fact, there is tremendous amount of popular literature as well. And in that literature, you will find a number of research and scholarly references. So, as a matter of fact, I would suggest that as a practitioner, you should undergo a mindfulness training yourself in order to get the first-hand experience so that you are speaking from a position of authority. Here are the findings of some of the very initial research that was done into mindfulness and its clinical application. I've given the reference below, and you can find many more on the internet yourself. And this is what the report had to say way back in 1982, which is something like about 35 years ago. The first one is that they conducted a 10-week stress reduction and relaxation program. It involved 90 chronic pain patients who were trained in mindfulness meditation. These patients had various types of pains and various levels and degrees of pain, which included facial pain, angina pectoris, gastrointestinal pain, neck, shoulder, head. 10 weeks after they were into the program, 65% or 2 people out of 3 showed a reduction of 33% on the pain rating index. 50% showed more than 50% reduction. These are tremendously successful rates. The people were taught to do a meditation, and the intervention was only 20 minutes a day. Just 20 minutes of day, no medication, and it is self-administered. Each person does the meditation himself or herself not in a clinical surrounding, but at home, once they have been given 3 training sessions. This is a very good report, which I would suggest each one of you should refer to if it is possible. And the improvements that were observed after these 10 weeks, they were found to have been maintained up to 15 months after the meditation training was done. So it had a long lasting effect. It was not just during the period of meditation. So as a practitioner, I would very sincerely request you to read the literature, learn some meditation techniques yourself so that you can guide your patients and you can support what you say with the authentic experience that you carry within yourself. It's also very good to help yourself and your family members as well. That brings us to the end of this video, and I will just summarize what we saw, the main points once again. As we said, we must understand the person in pain. Very often we lose sight of that because we are just busy recording modalities and descriptors of pain. But please remember, there is a person who is in pain, and that person is calling out for help. You should be able to provide support. The first thing that is essential is you should be listening to the person. The other support that you can provide is to find groups, support groups. There are many organizations where the person can get help from fellow sufferers. And the last point that we discussed was that mindfulness or meditation can be very effective in helping people in any kind of pain. That is supported by tremendous amount of research and clinical data that is available with us. So it is not just a belief system, it's a clinical fact. So we must take advantage of that. So that brings us to the end of this video and the lesson. Please go and attempt the completion quiz, and once you have completed that, you would have completed this educational module. Thank you very much for your attention, and I hope what we discussed in this module will help you in your clinical practice. There is some supplementary material which will give you links to other information that is very useful. There are some links to YouTube which will give you a very good idea of the anatomy of the nerves that are involved in this condition. And best of all, please come back on the forum with your ideas, suggestions, discussions, questions, and maintain the connectivity with your network that you have formed by now with the other participants of the group. So thank you very much for your attention, and bye-bye.